Welcome to Nurses Lab. This section explores the essential steps required for effective preparation for nursing licensure examinations, including the NCLEX and Prometric exams. These examinations are crucial for obtaining a practice license as a registered nurse in various Western countries, as well as through the NCLEX-RN examination and the Pearson VUE Prometric examination in Middle Eastern countries. In this discussion, particular emphasis will be placed on the quiz-type examination methodology as it pertains to the central nervous system. This approach is designed to help candidates build confidence and competence in tackling central nervous system questions commonly encountered in licensure exams. Let's dive into the preparation. Question number 1. Please select the right answer. A 56-year-old client with a history of hypertension suddenly develops slurred speech and right-sided weakness. What is the nurse's priority action? Option A, perform a complete neurological assessment. Option B, notify the healthcare provider immediately. Option C, prepare the client for CT scan of the head. Option D, assess blood glucose level. Correct answer is option B. Sudden neurological deficits suggest stroke. Immediate provider notification is priority. So the answer is notify the healthcare provider immediately. Let's see its explanation or rationale. Explanation for option A. Assessment is important, but not first step in acute emergency. Explanation for option C. CT is needed, but requires provider order. Explanation for option D. Hypoglycemia can mimic stroke, but priority is rapid provider notification. Question number 2. Please select the right answer. A client with Parkinson's disease is prescribed levodopa/carbidopa. Which statement indicates correct understanding of the medication? Option A, this drug will cure my Parkinson's disease. Option B, I should expect my tremors to improve over time. Option C, I can stop taking the medication once I feel better. Option D, I should take this medication with a high-protein meal. Correct answer is option B. Levodopa improves motor symptoms, but does not cure disease. So the answer is I should expect my tremors to improve over time. Let's see its explanation or rationale. Explanation for option A. Parkinson's is chronic and progressive. Explanation for option C. Abrupt withdrawal can cause rebound symptoms. Explanation for option D. High protein interferes with absorption. Question number 3. Please select the right answer. A client with bacterial meningitis is admitted. Which infection control measures should the nurse implement? Option A. Place the client on droplet precautions. Option B. Wear a surgical mask when within 3 feet of the client. Option C. Restrict visitors until antibiotics are completed. Option D. Maintain the client in a private room. Option E. Initiate airborne precautions. Correct answer is option A, B, and D. A. Meningitis requires droplet precautions. B. Surgical mask within 3 feet prevents transmission. D. Private room reduces exposure. So the answer is A. Place the client on droplet precautions. B. Wear surgical mask when within 3 feet of the client. D. Maintain the client in a private room. Let's see its explanation or rationale. Explanation for option C. Visitors may be allowed with PPE. Explanation for option E. Airborne precautions are not required. Question number 4. Please select the right answer. A client with increased intracranial pressure, ICP, has a Glasgow Coma Scale score of 8. Which intervention is priority? Option A, elevate the head of the bed to 30 degrees. Option B, encourage oral fluids. Option C, administer opioid analgesics for pain. Option D, place the client in Trendelenburg position.
Correct answer is option A. Elevating head of bed promotes venous drainage and reduces ICP. So the answer is elevate the head of the bed to 30 degrees. Let's see its explanation or rationale. Explanation for option B, fluids may worsen cerebral edema. Explanation for option C, opioids depress LOC and mask neuro changes. Explanation for option D, Trendelenburg increases ICP. Question number 5. Please select the right answer. A nurse is caring for a client with spinal cord injury at T4 who reports sudden pounding headache and flushing. Place the steps in correct order to manage suspected autonomic dysreflexia. Option A, sit the client upright. Option B, loosen restrictive clothing. Option C, administer antihypertensive medication if prescribed. Option D, assess bladder for distension. Option E, notify the healthcare provider. Correct answer is option A, B, C, D, and E. So the answer is in the following order. A, sit the client upright. B, loosen restrictive clothing. C, assess bladder for distension. D, administer antihypertensive medication if prescribed. E, notify the healthcare provider. Let's see its explanation or rationale. Explanation for option A, upright position lowers BP. Explanation for option B, loosen clothing to reduce stimuli. Explanation for option C, bladder distension is common trigger. Explanation for option D, medication may be required. Explanation for option E, provider notified after initial interventions. Question number 6. Please select the right answer. A client recently diagnosed with multiple sclerosis says, "I'm afraid I'll lose all independence." What is the nurse's best response? Option A, don't worry, many people live normal lives with multiple sclerosis. Option B, tell me more about your concerns and what independence means to you. Option C, you should focus on the positive aspects of your life. Option D, I'll ask the doctor to prescribe medication for anxiety. Correct answer is option B, encourages expression and therapeutic communication. So the answer is B, tell me more about your concerns and what independence means to you. Let's see its explanation or rationale. Explanation for option A, false reassurance. Explanation for option C, minimizes client's feelings. Explanation for option D, medication may help but does not address emotional need. Question number 7. Please select the right answer. A client with a traumatic brain injury develops clear drainage from the nose. What is the nurse's priority action? Option A, test the fluid for glucose. Option B, insert a nasogastric tube. Option C, apply firm pressure to the nares. Option D, document the amount of drainage. Correct answer is option A. Correct nasal drainage may indicate cerebral spinal fluid leak. glucose testing confirms. So the answer is A. Test the fluid for glucose. Let's see its explanation or rationale. Explanation for option B. NG tube contraindicated with suspected skull fracture. Explanation for option C. Pressure may increase ICP. Explanation for option D. Documentation is important but not priority. Question number 8. Please select the right answer. A client with seizure disorder is prescribed phenytoin. Which teaching should the nurse provide? Option A. Brush and floss vigorously to prevent gum problems. Option B. Report any rash or skin changes immediately. Option C. Take the medication only when you feel a seizure coming. Option D. Stop the medication if you experience drowsiness. Correct answer is option B. Rash may indicate Stevens-Johnson syndrome, a serious adverse effect. So the answer is B. Report any rash or skin changes immediately. Let's see its explanation or rationale. Explanation for option A. Vigorous brushing worsens gingival hyperplasia. Explanation for option C. Phenytoin must be taken consistently. Explanation for option D. Drowsiness is common and not reason to stop phenytoin. Question number 9. Please select the right answer. A nurse is teaching a client with migraine headaches about lifestyle modifications. Which statement indicates correct understanding? Option A. I will keep a diary to identify triggers. Option B. I should avoid taking prescribed medications during an attack. Option C. I will increase caffeine intake to prevent headaches. Option D. I should exercise only during a migraine episode. Correct answer is option A. Identifying triggers helps prevent migraines. So the answer is A. I will keep a diary to identify triggers. Let's see its explanation or rationale. Explanation for option B. Medications should be taken during attacks. Explanation for option C. Excess caffeine can trigger migraines. Explanation for option D. Exercise during migraine worsens symptoms. Question number 10. Please select the right answer. A 70-year-old client with Alzheimer's disease is admitted for increasing confusion and wandering at night. Which intervention is most appropriate? Option A. Place the client in physical restraints at night. Option B. Provide a calm environment with nightlight. Option C. Administer sedative medication routinely. Option D. Lock the client's room door. Correct answer is option B. Calm environment and nightlight reduce confusion and promote safety. So the answer is B. Provide a calm environment with nightlight. Let's see its explanation or rationale. Explanation for option A. Restraints increase agitation and risk. Explanation for option C. Sedatives may worsen confusion. Explanation for option D. Locking doors is unsafe. Question number 11. Please select the right answer. A client with a recent head injury develops a sudden increase in blood pressure, bradycardia, and irregular respirations. What does this indicate? Option A. Hypovolemic shock. Option B. Cushing's triad. Option C. Myocardial infarction. Option D. Pulmonary embolism. Correct answer is option B. Cushing's triad indicates increased intracranial pressure. So the answer is B. Cushing's triad. Let's see its explanation or rationale. Explanation for option A. Hypovolemic shock presents with hypotension and tachycardia. Explanation for option C. MI presents with chest pain and ECG changes. Explanation for option D. PE causes dyspnea and hypoxemia, not bradycardia.
Question number 12. Please select the right answer. A client with epilepsy is prescribed valproic acid. Which lab value should the nurse monitor closely? Option A, serum potassium. Option B, liver function tests. Option C, serum calcium. Option D, hemoglobin A1C.
Correct answer is option B. Valproic acid can cause hepatotoxicity, monitor liver enzymes. So the answer is B, liver function test. Let's see its explanation or rationale. Explanation for option A. Potassium is not directly affected. Explanation for option C. Calcium is unrelated. Explanation for option D. Hemoglobin A1C monitors diabetes, not valproic acid therapy. Question number 13. Please select the right answer. A client with a spinal cord injury at C5 is at risk for respiratory complications. Which interventions should the nurse implement? Option A, monitor respiratory rates and effort. Option B, keep emergency airway equipment at bedside. Option C, encourage intensive spirometry. Option D, position client flat in bed at all times. Option E, assess for use of accessory muscles.
Correct answer is option A, B, C, and E. So the answer is A, monitor respiratory rate and effort. B, keep emergency airway equipment at bedside. C, encourage intensive spirometry. And E, assess for use of accessory muscles. Let's see its explanation or rationale. Explanation for option A, respiratory monitoring is essential. Explanation for option B, airway equipment ensures rapid response. Explanation for option C, intensive spirometry prevents atelectasis. Explanation for option E, accessory muscle use indicates distress. The wrong option, particularly for this question, is option D. An explanation is flat positioning impairs ventilation. Question number 14. Please select the right answer. A client with Guillain-Barré syndrome develops shallow respirations and weak cough. What is the nurse's priority action? Option A, prepare for intubation and mechanical ventilation. Option B, encourage oral fluids. Option C, administer prescribed analgesics. Option D, provide emotional support. Correct answer is option A. Respiratory failure is life-threatening. Intubation may be required. So the answer is A, prepare for intubation and mechanical ventilation. Let's see its explanation or rationale. Explanation for option B, fluids do not address respiratory compromise. Explanation for option C, pain control is secondary. Explanation for option D, support is important but not priority. Question number 15. Please select the right answer. A nurse is caring for a client with increased ICP. Place the interventions in the correct order. Option A, monitor neurological status frequently. Option B, maintain neutral head alignment. Option C, administer prescribed osmotic diuretic. Option D, limit suctional to less than 10 seconds. Option E, elevate head of bed to 30 degrees.
correct answer is options A, B, C, D, and E. The correct order is as follows.
Okay. A. Elevate head of bed to 30 degrees. B. Maintain neutral head alignment. C. Administer prescribed osmotic diuretic. D. Limit suctioning to less than 10 seconds. And E. Monitor neurological status frequently.
Let's see its explanation or rationale. Explanation for option A. Positioning first reduces ICP. Explanation for option B. Neutral alignment prevents venous obstruction. Explanation for option C. Medication reduces cerebral edema. Explanation for option D. Suctioning limited to prevent ICP spikes. And explanation for option E. Frequent monitoring ensures early detection of changes.
Question number 16. Please select the right answer. A client newly diagnosed with amyotrophic lateral sclerosis, ALS, says, "I'm terrified of losing my ability to breathe." What is the nurse's best response? Option A, "Don't worry, you'll be fine for many years." Option B, "Tell me more about your fears and concerns." Option C, "You should focus on staying positive." Option D, "I'll ask the provider to prescribe medication for anxiety." Correct answer is option B, encourages therapeutic communication and expression of fears. So the correct answer is B, "Tell me more about your fears and concerns." Let's see its explanation or rationale. Explanation for option A, false reassurance. Explanation for option C, minimizes client's feelings. Explanation for option D, medication may help but does not address emotional need. Question number 17. Please select the right answer. A client with a basilar skull fracture has periorbital ecchymosis, raccoon eyes. What is the nurse's priority action? Option A, insert a nasogastric tube for feeding. Option B, monitor for cerebrospinal fluid leakage. Option C, apply cold compresses to the eyes. Option D, document the bruising in the chart. Correct answer is option B. Cerebrospinal fluid leak increases risk of meningitis. Monitor closely. So the correct answer is B. Monitor for cerebrospinal fluid leakage. Let's see its explanation or rationale. Explanation for option A. NG tube contraindicated with skull fracture. Explanation for option C. Cold compresses do not address risk. Explanation for option D. Documentation is important but not priority. Question number 18. Please select the right answer. A client with multiple sclerosis is prescribed interferon beta injections. Which teaching is most important? Option A, rotate injection sites to prevent skin irritation. Option B, take the medication only when symptoms worsen. Option C, avoid all physical activity while on therapy. Option D, stop the medication if you experience flu-like symptoms. Correct answer is option A. Rotating injection sites prevents irritation of the skin. So the correct answer is A. Rotate injection sites to prevent skin irritation. Let's see its explanation or rationale. Explanation for option B. Medication must be taken consistently. Explanation for option C. Physical activity is encouraged. Explanation for option D. Flu-like symptoms are common and manageable, not reason to stop. Question number 19. Please select the right answer.
A nurse is teaching a community group about stroke prevention. Which statement indicates correct understanding? Option A, I should monitor my blood pressure regularly. Option B, I can smoke occasionally without increasing risk. Option C, I should avoid exercise to prevent blood pressure spikes. Option D, I should increase salt intake to maintain circulation. Correct answer is option A. Hypertension is a major risk factor for stroke. So the correct answer is A. I should monitor my blood pressure regularly. Let's see its explanation or rationale. Explanation for option B, smoking increases stroke risk. Explanation for option C, exercise reduces risk. Explanation for option D, high salt intake worsens hypertension. Question number 20. Please select the right answer. A 65-year-old client with a history of seizures is admitted after experiencing status epilepticus. Which interventions are appropriate after seizure activity stops? Select all that apply. Option A, place client in side-lying position. Option B, monitor vital signs and oxygen saturation. Option C, provide oral fluids immediately. Option D, reassured client and reorient. Option E, document duration and characteristics of seizure. Correct answer is option A, B, D, and E. A, place client in side-lying position. B, monitor vital signs and oxygen saturation. D, reassure client and reorient. E, document duration and characteristics of seizure. Let's see its explanation or rationale. Explanation for option A, sideline prevents aspiration. Explanation for option B, monitoring ensures stability. Explanation for option D, reassurance supports psychosocial needs. Explanation for option E, documentation provides essential clinical data. Let's see the explanation for the wrong answer. Explanation for option C, oral intake is unsafe until gag reflex returns. Thank you for engaging with this section on nursing licensure examination preparation. We appreciate your dedication to advancing your knowledge and skills and hope that this discussion on the quiz-type examination questions for NCLEX-RN and Prometric in central nervous system has provided you valuable insights. Wishing you the very best in your studies and future nursing career. See you in our next video. Stay tuned.